With the holidays bringing people together, new concerns this morning as hospitalizations for both COVID and flu are on the rise.
When you think about like some of the winter and spring Omicron surges where it was just going crazy and we have like 100,000 plus cases, 1 million cases a day, we have higher hospitalizations now, which is mind-boggling.
According to the CDC, flu hospitalizations rose 32% from last week's report, with nearly 26,000 admissions, the highest in a decade, while COVID hospitalizations are up 14% week to week. In New York, health officials are renewing the call to mask up, indoors, on public transportation, and in crowded outdoor settings, as flu cases spike 64% from last week.
This is an unusual flu season, and it's being impacted by the fact that most Americans have been traveling and with cold weather have been indoors in smaller spaces and not wearing masks or taking the precautions that we did to keep flu numbers really low over the last 2 years.
For Kelly Trout, a mother of 2 toddlers in Virginia, flu season has already been a challenge for her family.
We had the flu last weekend, but before that, we'd been sick on and off, mostly on, for about 2 months.
She says she's thankful the kids were able to get their flu shots in time for the holidays, but worries about potential shortages of over-the-counter medicine.
We really don't have a plan, but probably after one more illness, I'll be scouring, the internet, trying to find a stockpile.
In a statement, Johnson & Johnson recognizing the high demand for children's Tylenol and Motrin, writing in part, while products may be less readily available at some stores, we are not experiencing widespread shortages.
We don't have the kind of shortages where we need to get manufacturers to make more. We need to just make sure they end up in the right places.
Amid these shortages, the makers of Tamiflu are also saying their medicines are readily available for pharmacies to order. So if you're in need of a certain medicine that appears to be in short supply, our experts advise calling around to try to find it. You will eventually find it. So that's going to be cold comfort for a lot of people.
That's hopeful, Stephanie. Eventually, you'll find it. Let's get more from NBC News medical contributor Dr. Natalie Azar. I got to say, medicine shortages, it's very scary if you're talking about Motrin or Tylenol for kids. We all use it when our kids get a fever. I mean, what should parents do?
Well, so first of all, a couple of things. Number one, and I don't want to say this to sound too glib, but definitely call your pediatrician and ask what options are available, because if your child is 2 and over, they can actually do chewables. Once your child gets to the age of like 11 or 12, it's a good time to teach them how to take a tablet or a capsule, right? Because what we're talking about are the shortages of liquid Motrin and liquid Tylenol. And just like a pearl for all parents out there, and I'm sure they know this, but kids under 3 months, any fever, call your pediatrician. But some older children, if it's low grade, they don't necessarily have to medicate through it.
I mean, this is the time of year where everybody's packing into houses, older people, little toddlers, we're all together. Inevitably, someone's going to have something. So what's the best advice on how to navigate that?
I know. Up until this year, we were really just dominating with COVID. But, the winter season has always been, it's always a flurry of respiratory viruses. And my, gold standard is just plan your activities around the most vulnerable person in your household. And for some people, that's a newborn. For some others, it's an older individual, right? But the thing, we're not helpless. Make sure you're up to date on the COVID booster, and you can still get your flu shot over 65. There's a high dose. It's just in time for the December holidays. If you get vaccinated now, stay home if you're sick. The usual precautions still apply here, Hoda.
Dr. Natalie, last few days, New York City issues this health advisory, now suggesting that people wear masks once again inside crowded spaces. Do you think that's where we're headed again? Are we going to be masking up over the next few months?
I don't know about the mandate, right? I don't know how much we have an appetite for a mandate anymore. But once we see the hospital strain happen, don't be too surprised if that were to happen. And what I mean by that is, like, if 10% of the hospital beds are being taken up by COVID patients for a 2-week period, I think LA is in that situation right now. That's a real cause for concern. COVID and flu and RSV obviously lands people in the hospital. But on public transportation, I don't know if I said this to you last week, Craig, I've been masking on the subway and in the bus and from the beginning. And I people look at me and I think something wrong with me. And I'm like the only one who's doing it. So really, New Yorkers out there, especially if you're living in an urban area, consider wearing a mask on public transportation, for goodness sakes. It really will protect you.
Especially if you don't feel well.
Especially if you don't feel well.
Thank you.
Thanks, Dr. Azar.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.